Hi guys, this is Preeti and you're watching Med Resolution. In this video, I'll be saying all the RS questions of the chapter hemodynamic disorders and thromboembolism and shock. You know that RS questions will be asked frequently in all the university exams. Still, we neglect doing those. Through my videos, I'll be teaching you all the RS questions. So please do like, share, and subscribe to my channel. So without wasting time, we'll quickly see what are the questions from this chapter. That is the CVC lung. That is chronic venous congestion of lung. When lung is near the lung, there are veins, no pulmonary veins. If those are congested, blood will stay in the lung itself. So what will be the causes for that, and gross appearance, how the lung grossly appears during that condition, microscopic feature under the microscope, the lung tissue, how it appears, and heart failure cells which can be seen in under the microscope, about that. And stain we cannot see directly with the normal eosinophilic and hematoxin stain. We have to use a special stain to see this lung tissue, like heart failure cells. These are the subquestions which are asked under the CVC lung. CVC lung is also known as brown induration of lung. They may ask like this also, brown induration of lung. So you need to know all this. This heart failure cells or stain used to see the heart failure cell is separately asked for a 3-mark question or 5-mark question. This entire thing for a 3 or 5-mark question. They may ask like histopathology part, or they may directly ask you the theory points. And other important question will be CVC liver. In CVC there are so many CVC lung, CVC when left CVC lung, CVC liver, CVC kidney, CVC spleen. So many things are there. When right heart failure occurs, all this liver, kidney and spleen will be affected. When left heart failure occurs, there will be back pressure and then lung will be affected. So CVC lung. So of all those kidney, liver and spleen, these lung and liver are important. Under this subquestion will be causes of this CVC liver, that is the right heart failure, and other causes, the gross appearance and microscopic appearance of the liver during this congestion. All these are important for 5 or 3 marks. And edema which is important question for a 10-mark question. They'll ask causes, pathogens and cardiac edema. They may ask cardiac edema separately, or they may ask here only. And types also they'll ask. In the subquestion only, they may ask what is the difference between the transudate and exudate, that is edemal fluid, where there are 2 types of edemal fluid, that is transudate and exudate. They may ask that question for 5 marks, or else in the edema entirely the pathogenesis cause and all this for a 10 mark they'll ask. And thrombus is also important question for the 10 marks if they ask under these headings, that is definition, classification of thrombus, that is air thrombus, fat thrombus, venous thrombus, arterial thrombus. The difference between those two also they can ask. What is the fate of this thrombi? They may dissolve, or they'll become dissolve, or they become an emboli and then travel into the other places, and all the fate they'll ask. Which are triad of thrombus they'll ask. Pathogenesis and which are triad of thrombosis they may ask separately, or venous thrombosis, pathogenesis they may ask separately. And all this under the thrombus, this is also important for a question for a 10 marks. And embolism thrombus only if it start mobile and like obstruct other smaller vasculature, that is called as embolism also important for a question for 10 marks. The definition, examples of embolism, that is air embolism, fat embolism, amniotic embolism, all those types you have to write. And examples for this embolism, fat embolism, air embolism separately they may ask for you for the 3-mark or 5-mark question. And other important question is, this is a transudate or exudate. This they may ask under edema only, or they may ask separately for a 5-mark question. And infraction is also important. It's really important for the 10-mark question. That is the definition, types and site, and organs affected during the infractions that they'll ask. A shock is important question in a surgery, physiology, then this pathology, everywhere the shock is important. Definition of shock, classification of shock, stages of shock, that is progressive, non-progressive and irreversible types of shock. Septic shock is also important for a 5-mark question. Septic shock is also asked as endotoxic shock. And what are the morphological changes of all the organs during the shock, that is important, separately important for 3-mark question, or they may ask under the sub-question of a 10-mark question. This is all the important questions of the hemodynamic disorders and thromboemboli and the shock. Mainly you need to learn about a CVC liver, CVC lung, CVC liver, CVC lung, difference between transudate, exudate, edema, shock, then a thrombi and emboli. Infraction is later really important. Only this 8 questions if you prepare through 8 videos. you can easily do it through your university exam, and you'll get more time for the preparation, to get knowledge. You can read so many books. Only for university exam you prepare through 8 videos, and then remaining time you can utilize for your knowledge, gaining knowledge by reading textbooks. If you find this video helpful, please do like, share and subscribe to my channel. Thank you.